So, mm, go ahead, Jessica.
Okay. Hello, my name is Jessica. We have Group 10 here. We're going to be doing our organizational analysis project, and we're brought here today with um, Raina, Emily, me, Jessica, and Claudia. Um, Here's our interview of the Chief Financial Officer, CFO of Hope Family Health Services. And here's the Hope Family Services logo. Sorry. About CFO Richard C. Milky.
Yeah, so I interviewed Richard. He has 32 years of experience in healthcare administration, and he's been with Hope Family Health for 3 years. His duties are preparing payroll, financial audits, budgeting, grants management, supervision of accounting, billing, staffing, and office manager of the receptionist.
Here's a Q&A.
So the first question I asked in the Q&A was to Richard, asking, "Do you enjoy what you do? Why or why not?" And CFO Richard Melby clearly loves what he does. He's held many leadership roles, but he's found his passion in finance and accounting. What stands out is how much he values learning every day and making an impact on others' lives. Even though he isn't in direct patient care, he sees his role as essential to keeping the clinic running and accessible for the community.
Do they enjoy what they do? Continued. I oversee the grant process, which helps fund us and makes prices and access to healthcare so much more affordable. I also keep out finances in order so financial auditors can audit our grant money and report back to the state that we are complaining, which means we will be receiving grants to keep our doors open to the community. I have been in healthcare administration for over 30 years, and with certainty I can say if I had the chance to go back 30 years and do it all over again, I would without a doubt. By CFO Richard C. Milky.
Okay, and when we asked him what plans do they have for their career in healthcare administration, he responded, "Well, with over a little over 30 years of working in healthcare, I don't think I have many more plans for my career. I've done it all these past 30 years as CEO, CFO, COO, and he was professor for a short time, teaching a health administration class. He's done a little bit of everything, and he knows where he wants to be now, and he really highly doubts that anything is going to be changing anytime soon. He believes that God guided him to this clinic and believes that he will retire from the clinic, although not right now. Then we asked him what advice he would give a college student looking forward to a career in healthcare administration. He said it was a great degree. There's a lot of business in the degree, and it's a challenging field. And it's different every day, but it's all worth it. We have to learn how to overcome change. He said it twice already. He believes healthcare is ever changing. Healthcare is a revolving door, and you don't have a choice but to go with the flow. I would also add that I should keep in mind the reason for going into this career. Sometimes it is easy to lose track of the reason why we're doing this. I say this because of all that is happening right now in the world.
Another one of the key pieces of advice from CFO Milky is to remember that healthcare is always changing. He stresses the importance of staying grounded in your why, the reason you choose to work in healthcare. Even when policies shift or things get tough, your main job is to help people. And that mindset is what keeps you going in this field.
Here's our organization overview of Hope Family Health Services. Organization overview and history. Hope Family Health Services is a nonprofit, federally qualified health center, FQHC, founded in 2005 by nurse practitioner Jenny Ditz after losing her job. Ditz felt a calling to serve uninsured and undeserved populations in rural areas. With a mission to care for those without access to health care, the organization began. The 5 employees operated from a double-wide trailer. By the end of that year, patient demand necessitated a move to a larger clinic. Continued growth led to the addition of behavioral health services in 2014, supported by a federal grant and a new 13,000 square foot facility in Westmoreland. Since then, Hope has added a second clinic in Malcolm County, Hope West Side, as well as dental care, a pharmacy. Imaging services include mammography and most recently a new clinic in Gallatin at the Sumner Regional Medical Center Plaza in 2023. The organization has grown from 5 staff members to over 80 employees.
Okay, and let's look at their mission, values, and vision for Hope Family Health Services. Their mission is to restore dignity, faith, health, and hope in patients by making them active partners in their healing process while delivering care with love and compassion. Their vision is to build a future where high quality healthcare is accessible and affordable to everyone. And their values include equality, dignity, compassion, accessibility, and inclusion.
Hope supports these guiding principles through services such as a sliding fee scale, which adjusts costs based on income and family size, ensuring financial access to the uninsured and underinsured. Additionally, they have a Hope Assistant Fund. It enables patients in financial crisis to receive up to $500 in support for essential needs such as like medications or bills. The program reflects the organization's belief that all people, regardless of income, background, or insurance status, deserve quality health care.
Now we're going to be talking about Hope's organizational structure, hierarchy, and leadership. Hope Family Health Services uses a community-centered structure. Decisions are made by a board of directors that includes patients and local leaders. This ensures that the voices of the community help guide the clinic. There's a balance between top-down leadership and bottom-up feedback, which helps keep the organization connected to those it serves.
This is organizational structure, hierarchy, and leadership. At the administrative level, Hope is led by the founder and CEO, Jenny Ditz. The leadership team includes roles such as Chief Financial Officer, CFO, Chief Operations Officer, COO, department heads, and clinic managers.
Okay, and when it comes to Hope's partners and affiliations, they maintain strong relationships with partners and sponsors that are shown to the right here. These relationships provide infrastructure support, patient services, and expanded access to resources for both the organization members and the patient population. Some of their healthcare partners include High Point Health Sumner, Ascension St. Thomas, and some of their business partners include North Central Telephone Cooperative and the Food Line.
As an FQHC, Hope's main competitors are the local health clinics and regional hospitals offering similar services. Competitors include Sumner Regional Medical Center, especially because they're located right beside the Hope's new clinic. There's private health practices with broader financial and marketing resources. And upcoming threats include urgent care chains and telehealth services that attract patients with convenience and technology.
Hope sets itself apart by offering a full range of services, from behavioral health to dental and pharmacy care. What really makes them unique is their sliding scale pricing, which helps people afford care no matter their income. They continue to expand into areas like Gallatin, always trying to increase access and keep the community involved.
Major organizational challenges include burnout, low morale, compassion fatigue, compensation for higher demand, retention of employees, and employee productivity.
Kind of just piggybacking off of that, expanding on it a little bit. A major challenge for Hope is employee burnout and low morale related to workload and limited staffing. As a nonprofit serving a high need population, staff often take on multiple responsibilities that can be physically and emotionally draining. Many employees are deeply invested in the mission of this organization, which can lead to empathy fatigue. As the demand for services continued to grow with limited funding and competitive markets, Hope sometimes struggles to offer compensation and benefits comparable to larger healthcare providers, affecting productivity, employee retention, and organizational morale.
The future of healthcare delivery, Hope Family Health Services.
How would you motivate each person to prepare for and contribute to the future of healthcare delivery? To motivate individuals in the healthcare industry to prepare for and contribute to the future of healthcare delivery, we should empower them to lead change rather than simply adapt to it. Demonstrating skills such as innovation can enhance patient care, reduce burnout, and improve patient outcomes.
The future of healthcare is driven by innovation. Technologies like AI and telemedicine are changing how we care for patients. But with that comes burnout. To help healthcare workers stay motivated and feel supported, Hope promotes reward systems for good ideas and improved workflows. This shows people that their work matters.
What information would you share with your staff and how would you convey it? I want to communicate to my staff that their feelings are valid and that experiencing burnout is completely normal, especially given the nature of their work. It's important for them to understand that we are not just adapting to change, we are also playing a vital role in shaping the future of healthcare. I encourage my team to view the bigger picture and recognize that every job, no matter how big or small, contributes to advancing healthcare delivery. I will seek input from my staff and actively listen as we discuss strategies to reduce burnout and create a smoother workflow. Acknowledgement is crucial in making my team feel valued, so I plan to implement a bulletin board featuring staff spotlight stories that highlight how individual team members make a difference. Additionally, I will share our innovation goals with the staff and explain how each person fits into these objectives.
Okay, and when thinking about what format that we'd like to use to communicate this topic with staff, um, it's important to effectively communicate with them about burnout in the workplace, specifically using a two-part approach. The first part being a group presentation aimed at normalizing the conversation and reducing the stigma around burnout, either in person or virtually, including real stories or anonymous quotes from staff members themselves. Also conduct an open Q&A session and a discussion circle, giving staff the opportunity to share their input on the topic. The second part to this approach is a one-on-one coaching, available by request or referral for those who wish to have private conversations or need tailored strategies.
Rationale for why healthcare professionals should focus on future. Necessary coverage of several important topics include the necessity of focusing on the future of healthcare delivery, current challenges we must address, the significance of my staff in shaping the future of healthcare, what we can expect when preparing for the future of healthcare delivery. Healthcare professionals need to prioritize the future to be able to adapt to the rapid advances in technology, policy changes, evolving patient expectations, and dynamic workforce demands. By preparing for the future of healthcare delivery, we can reduce the risk of falling behind and improve outcomes for patients.
The next part we're talking about is how would you communicate with and inspire staff to prepare for the future using the previously outlined rationale. When motivating staff, the focus should be on support and inclusion. Everyone's role matters. By giving people tools and training, we help them grow with the field. Communication should be open and encouraging, with no pressure, just support. The goal is to empower people to make part in shaping the future of healthcare.
And here is a quote that we included at the end. It says, "It is not the strongest of species that survives, nor the most intelligent, but one of the most responsive to change," and it's by Charles Darwin. And this concludes our presentation.